My name is Katelyn Fowler, and I'm a doctoral student physical therapist at Regis University. Prior to Regis, I earned my bachelor's degree in exercise science at Westchester University of Pennsylvania. This is where I taught fitness classes and became team leader of fitness. Since middle school, I've been passionate about movement and living a healthy lifestyle, which positively impacted both my body and my mental health. This passion led me to pursue a career in physical therapy. However, I also struggled with exercise addiction and eating disorders for years. In 2020, my body essentially shut down. I could not walk comfortably for 6 months, endured chronic pain, extreme fatigue, joint numbness, and suffered from sleep loss, a racing resting heart rate, and depression. After months of chronic pain, endless doctor visits, and no answers, I knew it was my lifestyle that needed to change. I now recognize that there are so many pillars to health, not just physical. I am 30 pounds heavier than I used to be, but I'm also the happiest, healthiest, and most in tune with myself than ever. Treating patients as the whole person and looking at the biopsychosocial aspects of their lives will always be a priority to me. My personal experience with neurological symptoms sparked my interest in treating individuals with neurological conditions. I find the nervous system and neuroplasticity to be absolutely fascinating. And after studying conditions like stroke, spinal cord injury, Parkinson's disease, and more, I know I would thrive as a neurological physical therapist. Besides neurological physical therapy, I'm also interested in treating individuals with chronic pain and athletes, as I grew up an athlete myself. One of my greatest strengths is my ability to adapt quickly to new situations. I do believe that my CI would say that I can take feedback very well and apply it almost immediately. During my first clinical, I was doing 13 to 14-hour days, which includes the hour it takes to drive there, treat patients for 10 hours, and drive an hour home, while still maintaining time for myself and the people I love. A key strategy during that time, and always, is to start my day early and with a routine that sets my mind up for success. This helps me to stay grounded and think clearly under times of stress. Over the years, I've trained my brain to find the silver lining in almost any situation. With this said, another one of my strengths is my optimistic mindset. I believe in the power of a growth mindset and aim to empower my patients, helping them realize that they are stronger than their current challenges. I have a natural ability to build patient rapport because of the fact that I deeply value my relationships. I hope to show my patients and all that I interact with that they are seen, heard, and validated. Other than my interpersonal skills, I have excellent time management and problem-solving skills. I highly value feedback as I believe others have valuable insights to offer, and I'm committed to becoming the best physical therapist that I can be. During my first clinical education, giving and receiving feedback felt easy. My instructor and I were very open about expectations, strengths, and areas for improvement. I like to receive feedback after my performance, and I often like to reflect on my own performance first, and then receive further feedback from the expert. Nonetheless, I enjoy being challenged and pushed outside of my comfort zone. To best prepare for the clinical, I will review all the appropriate skills and content areas for the setting that I'm in. I plan on taking electives in electrophysiological testing and dry needling. I'd also like to continue to develop my manual therapy skills. After graduation, my goal is to work in an environment with skilled, motivated, and inspiring physical therapists who are committed to growing together. I believe it's easier to improve when surrounded by others who are equally dedicated. I value strong mentorship and collaboration. Ideally, I'd like to be getting mentorship in neurological management, but mentorship in any practice area that I'm working in would really excite me to help me develop my clinical skills and decision making. I'm seeking an organization that fosters growth and supports new grads. Thank you for your time, and I look forward to hearing from you.